Today I want to talk more about the discs of the spine. The discs are given a lot of attention when they create pain. Certainly people get a slip disc or a ruptured disc, and then it becomes an issue because often it needs surgery to correct that because it's pressing on the nerve. But I want to talk about the health of the disc, how to keep the disc healthy, what the disc does, and what we do to try to prevent it from getting to those points where it needs surgical intervention. First, let's just take a quick look at the disc and how it functions with the spine. So we see there that the disc is basically a shock absorber. And being a shock absorber, what it's doing is it's maintaining the ability of the spine to move in what we call axial compressive forces, meaning forces that go up and down. That's mostly what it does. It does help in twisting, bending, and those things as well. But because we're walking, riding in cars, jumping up and down, and doing all the things, the spine has to have this ability to compensate for that kind of motion. Otherwise, it would wear out very quickly. When a disc becomes, over time, the disc, however, because it's actually full of liquid on the inside, it's called a hydrogel, and the disc can degenerate because it dehydrates over time. And due to overuse and just aging, as that occurs, as the disc dehydrates, then the disc can create thinning in the disc. Let's take a look at how that works. So as you can see, as the disc becomes thinner, then what can occur is the actual vertebra, say this is L5 and this is L4, they more closely approximate each other as the disc becomes thinner. This causes a few problems. One is that the hole where the nerve is coming out can be compromised so that the nerve can be pinched. That's one. Number two is that those joints in the back of the spine, those are called facet joints, also collapse on top of each other, and that can cause rubbing. It can irritate the ligament that's surrounding those joints, and they can be a great source of pain as well. This is called facet syndrome when that occurs, because they're called the facet joints. It's probably one of the more common reasons that people get relief from chiropractic is adjusting those facet joints and moving them, and that creates relief. So what we want to do is to keep the disc as healthy and keep it as viable as we can, really for the whole of our life. And to do that, there are many things that we need to do. From a chiropractic point of view, we say that getting an adjustment regularly is important to do that because it keeps the spine moving. As the spine is able to move better, then it's able to get waste products out, nutrition into the disc. We catch those areas of malfunction of the joint where it starts to lose its ability to move, what we call chiropractic subluxations. And we catch those before they become a real problem and release the joint and allow it to move again. That not only gives release of immediate pain, but then it also prevents that disc from wearing out. Then looking at the posture, as I talked about in other videos, those postural changes like forward head tilt, sway back, to low hip, high shoulder, those biomechanical changes chronically over time will wear the discs out. So we want to correct those if possible. You see, the disc is not replaceable. And the disc is extremely important. Our spine is one of the most important organs in our body because it's supporting our whole structure. Without it, we'll just be mush on the floor. We have to have our spine. And yet, we do very little to try to prevent it from wearing out. And usually we wait until there's a problem and then we go try to fix it. And chiropractic has attempted to educate patients about spinal maintenance care. Unfortunately, insurance companies don't want to cover that, but it's important to do regardless of coverage. Things to do to get adjusted regularly, to exercise regularly, have good diet, to sleep enough. We talked about in other videos how when we don't get enough sleep, the disc actually degenerates more because of it doesn't get a chance to bring fluid back into the disc overnight. There's so many things that in chiropractic we teach patients to try to maintain the discs of the spine and the joints of the spine so that it lasts as long as we do. So I'm hoping that this just educates you a little bit about what the discs are and what they do and what we can do to help maintain your spine beyond just treating you for pain control. Thank you.